nasolabial folds are an interesting part of anatomy and an interesting problem. First of all, they're never removed. Well, actually, I take that back. They can be removed. You actually can cut them out, which is a procedure that's almost never done these days. But what you're talking about is making them look better. And depending on the size and shape of your nasolabial folds, there are a number of things that can be done. If they're relatively minor and relatively small, they can be injected with a filler like Juvederm, and that will smooth or spackle these areas, and that will maintain for 6 to 9 months. It's also possible to inject with your own fat. Now, if they're really heavy in there, if they're combined with loose skin in the cheeks and jowls and hanging skin and a poor jawline, then what you're really talking about is having a facelift. The three things that I look at and evaluate in terms of whether or not people need a facelift of any kind is the extent of the nasolabial fold, how big the jowls are, and the condition of the neck. Depending on what is going on there, we can either do fillers, fat, a cheek lift, which is a more minimal version of a facelift, or in some people, if they have a lot of loose skin in the neck, then they need what we would call a traditional or a full facelift.